Okay.
All right.
All right. Hi, everybody. My name is Cameron. I'm with 2020 Meals, and we try to get really helpful information from people that are outside of the meal planning industry. And so today with me, I have Austin Hayward. He is actually a structural therapist. And so today he is going to be talking to us a little bit about what structural therapy means, the difference between that versus just typical massage, and then possibly why you might need it. He's actually located in the Austin area in Texas, and he just moved from New York not too long ago. So I'll go ahead and let Austin kind of tell you a little bit about his background, and then we can kind of move forward.
All righty. Well, I'm Austin. I moved down to Austin, Texas last October, so I'm fairly new here. I am a structural therapist. I got into structural therapy because of the own benefits that I experienced from it. It's been kind of exposed to me through my family for years, since I was a kid. But I had an injury while I was in the Marine Corps, and kind of busted up my knee. And I didn't want to get surgery. They said I could do certain things, and just the kind of statistics of a second surgery for the knee, I kind of just was turned off by it. So my father, who's actually been doing this for 20 years, flew out to where I was and helped me out, got me walking again, and gave me that idea that this is something I'd like to do. And I kind of decided to do the apprenticeship, and I just want to help people. So it's one of the reasons why I got into this field.
Well, great. Well, thank you so much for that explanation. So if anybody sees my cell phone, it's because I'm on Facebook Live. So I'm not texting, I'm not being rude. So thank you guys for not thinking I'm totally crazy. But okay, great. Well, thanks, Austin. I appreciate that. It's kind of nice to learn a little bit more about your background. And I know as a patient of yours, like I've really seen quite, a bit of difference, and along with the chiropractic care that I've gotten. And so it's definitely beneficial. And so I really do appreciate you jumping on with us. So I'm just going to kind of go through a couple of questions for you. And anybody, if you do have questions, just feel free to type it in the Facebook live stream or on Blab, and we'll definitely get to that at the end. So kind of how I talked about in the beginning is what's the difference between structural therapy and then what's versus massage, like a typical massage. Like let's just say somebody, just has aches and pains, or, if they're having neck problems or arthritis. I mean, what makes it so different that people might, want to seek out treatment this way versus going to a massage therapist?
Well, structural therapy it's a more of a targeted kind of treatment for these people that have pain. So it's specifically catered to treat these certain conditions, specifically arthritis, but it's definitely applicable to different kinds of shoulder pain, elbow pain, tendonitis and whatnot. And the main purpose of it is to stimulate muscles, because usually when, the muscles that control this joint are kind of out of whack or over contracted, it affects that whole joint. So how we look at it is that the joint is kind of the manifestation of what's going on with the muscles, opposed to, your joint is having arthritis based on whatever reason, or just, what they say, general degeneration. We look at it as, the muscles that control that joint are causing that arthritis. So what we have to do is treat what's moving that joint. Now, through structural therapy, we stimulate. So when a muscle is overly contracted for a long period of time, they can get different forms of what they call wasting away or atrophy. And what we want to do is get it out of that certain state that it's in, this over contractibility that it's in, and stimulate it through the certain points that we use and the warmth that we have on our hands. It penetrates deep, so it helps kind of make that muscle realize, like, okay, stop being so contracted for this. So you kind of have to work at a kind of a threshold to kind of encourage it to stop staying so contracted.
Okay.
The warmth brings more blood to the area. It's familiar. The warmth from our hands is more familiar, opposed to, so the main difference between structural therapy and massage therapy is the stimulation. We stimulate. Massage therapy tends to sedate. That's what we say. So, it's kind of, when someone says massage, you think, okay, it's relaxation, or, I'm just going to kind of go zone out, or deep tissue where they kind of, there's a tense sense of pounding away at a certain issue. I'm sure every one of us who's had a massage has experienced, you're like, oh my God, when is this going to stop? It's like the elbow and whatever.
Yeah.
Which is fine if that's what you want to do. That's what you're seeking out. There's nothing wrong with that. But with these type of pains and conditions, we don't want you to kind of, go away from the treatment, or kind of zone out, or fall asleep, or get out of your body, if you will. We want you to be there, present, because not only is the treatment kind of, it brings a certain amount of awareness to what's going on. So you can feel the differences between certain sides, different muscles that's getting worked on, that's actually contributing to whatever pains that you might be having.
Okay.
Does that make sense?
Yeah, it does, definitely. Well, perfect. So like how, like with you've kind of like, you worked on like my elbow, and like that's made a huge difference, just in general because you're able to kind of focus on specific muscles or tendons that may be linked to that specific joint.
Right. We look at it a whole kind of a system, not like, one muscle's affecting that elbow, because or whatever joint that might be, it's because even if one muscle, you feel it in that area, because of that one muscle that hurts, it's affecting how that entire joint works. So we work around the entire joint, and the joint's kind of away, on both sides of it, if you will, to see if you're compensating, or if it might be coming from a different area. Because if what they call referred pain, you might feel it in one area, but it's coming from another area.
Oh, okay. And so just kind of
because of nerve pathways, and pretty much because of nerve pathways and compensation. And
okay. Awesome. All right. And then so I guess kind of like, how is this form of therapy, I guess, more effective for the structural components of the body? I know you touched on it, a little bit, but can you get a little bit more detailed with it?
Yeah. So, so we say it's structural therapy because the muscles determine where the bones are. The bones are kind of anchor points. It's the structure of your body, and the balance between the joints and your muscles affects how all of that is aligned or works, really. So by addressing the muscles, you're also addressing the skeletal system.
Okay.
So the musculoskeletal pain, through the muscular work and working on the tension on those joints, we can affect a change in the alignment and condition of those joints and bones associated with those muscles.
Okay. Great. All right. And then so what happens to the muscle like during and after like the treatment? And like, why is it like, I understand like as far as the longevity of treatments would be different for each person, but yeah, like what happens to the muscle?
So when a muscle is contracted for a long period of time, it tends to become kind of cold and relative to its potential, if you will. So if something's really contracted for a long period of time, it can't pump as much blood through it. It can't expand and contract the way it's supposed to be. It's not pliable. Okay. So when we put pressure on it through these points with the warmth of the hand and stimulating it with those points, kind of bringing it to a kind of a threshold, it kind of disengages certain mechanisms within the muscle, or it kind of helps encourage it. There are these things in your muscles that are called muscle spindles and Golgi tendon organs. One's kind of a proprioceptor to kind of see where you are in space. Mm-hmm. The one, which is a muscle spindle, determines how fast the muscle expands or contracts. So usually when you pull a muscle, that spindle engages and it contracts really fast because it thinks it's expanding too fast and it's going to tear, so it contracts very quickly to protect itself.
Okay.
What we're trying to do it's kind of work on that muscle to stop being in a certain contracted position, if you will,
Mm-hmm.
and encourage it to become more pliable, to expand. And one of the main roles of a joint is, or of a muscle, is to generate heat. So the heat from our hands, which is one of the most familiar things the human body has, is touch. So from the warmth from our hand, this familiar warmth kind of helps it recognize and, to, what am I trying to say here? It's trying to encourage it, to be like, this is okay, to kind of loosen up, to extend.
Okay. Okay. So just kind of referring back to, again, my elbow, whenever I, had my 30th birthday and I went to the skating rink and I fell on my elbow and busted it up. And like immediately my muscle was trying to protect it. So it was like, oh, like, let's just keep this in, let's not give it too much of a movement state, put it in more of like a monetary state. Right.
Right. So
Okay.
kind of when you fell, it kind of really contracted or had like an overweight load on it that it's used to having. And then it's like, it contracts very quickly. And then now you're having this associated pain with your elbow and maybe up into your shoulder.
Mm-hmm.
And over time, the pain gets worse. It's contracted. It becomes cold.
Got it.
One way to treat it is to get the warmth in there deep, bring more blood flow in the area, and stimulate it to let it expand.
Okay. And so if somebody does incur an injury, is it best to come to you like right when it happens, or should you give it some time to kind of have the muscle like relax on its own so then that you can work on it a little bit more? What's your recommendation on that?
Well, usually I'd say, not too long. We don't, just because with acute injuries, there tends to be swelling. So, if you put more heat on a swollen area, it's just going to swell more. That's the main reason why, you put ice on it, is to restrict blood flow and restrict that inflammation.
Yeah.
So I'd say once you kind of feel that inflammation goes down, and sometimes, if you roll an ankle or something, it'll go away in a few days, like not a hard roll, but if you're like, kind of swollen up and it kind of hurts, your body can heal itself. So I don't want to be going in there and working on it and kind of making the situation worse when it's already swollen, because one of the main reasons, or one of the main things we're trying to do, is put more warmth in the area.
Mm-hmm. Okay. So would it be better to do like wait a week or 2 weeks, or is it just dependent on the injury at the time?
It is dependent on the injury, but I would say give it about a week, unless, if pertaining to an injury, right? Like there's an actual trauma, give it a little bit of time to see if it kind of cools down on its own.
Okay.
But if you're experiencing this kind of more of a chronic pain, something's hurting for a while, then I'd say come, as soon as you can.
Okay. All right. Cool. And then, so who would be like the best candidates, I guess, to get this type of therapy? I mean, would it be just anybody that has chronic pain or a specific injury? Is it people with like arthritis? Like what's the, why do people primarily seek out a structural therapist versus a massage therapist?
Well, I mean, unfortunately, it's a lot of the people that I have seen, they've tried so many different things. They're like, I've done this, I've done that, they're kind of worn out by it. But it's pretty much whoever, it's applicable to chronic pain. So people who've had pain for years, or, sometimes they seek treatment for whatever, and then from however means, and then it gets better, but then it gets worse. So it's not fully addressed.
Mm-hmm.
So people who have chronic pain, people who have arthritis, it's really good for arthritis. I think there's been too much of a explanation for arthritis to being this degenerative thing that kind of just happens through age. It's something you can't avoid, but we strongly believe that it's very regenerative. I was diagnosed with arthritis with my knee, and they just said, you have arthritis, kind of deal with it. But I'm completely healed from it through this work, and I'm moving around. I'm fine. I can do what I have to do.
Yeah.
People who are experienced just typical muscle joint pains that they might feel kind of not normal, if you will. Tendonitis, bursitis, if they've been diagnosed with that, and people who are trying to avoid surgery. I mean, sometimes conditions are so bad or so progressed that you have to get surgery, but that's like way down the line. And if someone else to do that, I usually refer it out. But anybody who's kind of in this, who's experienced any of these muscle joint pains, and it's also applicable to be a preventative type of body work. So even if you're kind of like, I have some aches and pains, I want to see what's going on, we can definitely feel whether, there's going to be an onset of arthritis or something else.
Yeah.
Kind of address before it gets to that stage.
Mm-hmm. Okay. All right, great. And then what specifically can you treat? Like what areas of the body, or is there anything else that might, like you're talking about focusing on like arthritis, like that's a good point. But is there like any like place particular on the body that people might need more treatment versus a different part of the body?
Well, I mean, a lot of people experience, lower back pain. So
Okay.
it's completely applicable to that. Some people I see, they have lower back pain, but then they say, oh, my knee's been hurting for however many years or what have you. So we also can treat that. It's pretty much any joint within the body that is, that you have really, that isn't really an autoimmune issue.
Okay.
Right. But it with certain conditions that do have arthritis, like rheumatoid arthritis, it's a autoimmune disease, but we can also kind of help reduce that arthritis that is accompanied with it.
Okay.
It might not necessarily 100% cure it, but it can definitely kind of reduce the onset of it or the intensity that you have with it.
Awesome. Okay. And then I know that you typically do an assessment like what you did with me and kind of find out what the issues are. But once you do that assessment, is there like a recommended treatment time? If it's just going to be, is it kind of like, okay, we go to see you and then it's, okay, my pain's gone, so I don't need to come back? Or is it something that would be good to kind of keep as an ongoing basis to make sure that the pain is not there anymore? Right.
The whole point of the work is to get you out of pain, to treat whatever is going on. So usually, it takes a while for you to get to a point that you're at now that you're like, I'm just in pain. So it's just going to take a little bit of time to get out of that pain. So I usually recommend, I do hour treatments. So, depending on the condition, it's usually once a week. But the whole point is to be able to, work on you. I give certain exercises, mainly stretches, that you can do at home so you can work on it yourself.
Mm-hmm.
So by me working on the issues, I'm facilitating you and the body to be able to heal itself.
Got it.
So it's not really like, come in one treatment and you'll be healed and you should leave.
Mm-hmm.
You'll probably feel a little bit different. You could be a little sore, but it's usually recommended once a week.
Okay. And so like with me, like how I was telling you, whenever we, had a meeting the other day, it was kind of like, okay, like once you like press like this area on my neck or whatever, it like immediately I could feel like the tension being released. Like just, it was like, I don't know, it was just like feeling like, what is that feeling? Like, what is the muscle doing to be able to, I guess, kind of release whatever it is? I don't know if it's just the muscle releasing or is it like a chemical or like, what is that?
Well, it's kind of like when, working on that threshold, it's gotten to that threshold and it's kind of, realizing, okay, it's okay that I could come to that state. I can expand. I don't have to be contracted. So that, I don't know, I don't really like to use that word release too much because it's, you're seeking the release, in certain, work and, and then it kind of gives this idea that, you there's a release and it's done. Like it's over. You know what I mean?
Like you mean like that there's not like longevity in like the idea of using that word is like, okay, it's a one and done, and you're just kind of,
Like
there's no.
it's a quick thing, right? It's like, oh, we're working on it. Do you feel the release? There is a release? Okay, it's done. It's good. You're healed.
But that's not the case. There's still a lot more going on, until the next treatment.
Right, because it's also with working on it, you're feeling it's getting stimulated. That's kind of that feeling that you get, kind of like like okay, like it hurts while you're kind of doing it a little bit, but then it feels way better.
Yeah.
So it's also how you use your body when you're not in treatment, which these exercises are supposed to help. Because it's everyday habits that we're forced to use our body, whether it be sitting at a computer or swinging a hammer or whatever. There's something that you're either doing repetitively, or you're maybe doing these little habits that might creep up that start the pain. There's also just the awareness in everyday life that you need to have in order for these to go away. Because if you kind of come and get work done and then do the same exact thing when you leave, there's not going to be much progress going.
Yeah. Okay. So then it does. So the treatment versus or incorporating the treatment and then also the exercises is really what's going to kind of make that difference.
Right. And the exercises are working on yourself when you're at home, as well as, once you get to that state where you're out of pain, you can either use them as a daily routine, as a preventative measure, or if for some reason there's another issue that's coming about that you're starting to feel, you have the tools yourself that you can work on it. And if it doesn't get better, then, you'd probably seek out a structural therapist to get work done to help,
Yeah.
make it progress to get better.
And so why do you feel like this is such a specific niche? Like, because you're the only one in Texas that does this. And so I think that's very interesting. Like, it's kind of like, oh, wow, okay. How do people know to find you? Like, why would they know to find you if they don't, if there's not so many of them out there? How do people find you, I guess, to know that it's best for them to use a structural therapist versus another means of treating the pain?
So, like, how can people find me?
Yeah, exactly. Yeah, because it seems like how narrow is some, like, I wouldn't have known to type in structural therapist, right?
Yeah.
So, yeah. How do people find, like, how do they know that they need to find somebody like you?
Well, if they're just experiencing any sort of pain, there's not many of us because it's kind of, it takes a lot to become a structural therapist. You have to do massage school. Obviously in different states, there's different requirements, but I did mine up in New York. That was almost 2 years. And then you have to do an apprenticeship.
Okay.
And that's usually at least 2 years. So I did a 2.5-year apprenticeship. So it's kind of like, well, for us, you go to massage school for 2 years and then you're kind of like, oh, I can go out and work. This is like, no, you got to, if you want to do it, you got to learn more.
Yeah.
But I have a website that you can find. It's called theartofstructuraltherapy.com.
Okay.
I have a Facebook page. It's the Art of Structural Therapy Austin.
Okay.
Go through that. But pretty much if you're experiencing any sort of pains that you're not sure what it is, or if somebody's diagnosed saying you do have arthritis, if you've gone to a doctor and they're, like they say you have to get surgery or whatever, then you can come, check it out, see how you feel. See if I can really help you if you don't want to get surgery. Just experiencing any sort of pains that you feel like just really, you shouldn't really be in pain in general, but just to be, as a preventative case.
Yeah. Okay.
I'm not sure if that answers your question.
No, it does. It does. Yeah. I was just wondering as far as, because people are always like, oh, well, I'm going to a sports therapist or a massage therapist or whatever for the pain. And so it's kind of, for me, I didn't know like how to find a structural therapist. I just, happened to go be getting chiropractic care. And then, you were there and to be able to kind of assist with that treatment. So it's nice to kind of just know like the orientation of where it came from and how people can find you and things like that, because I have never gone to a massage therapist and felt the relief that I have by just getting the treatments with you. And so that's why I really brought you on, is because I really want people to know and understand that, hey, there is a difference, and to not be in pain anymore, and also by not taking crazy measures such as surgery to not be in pain anymore, to do it in a more holistic way. I mean, I feel like that's the best way. And so that's why I brought you on, because I really wanted people to understand, what this stands for, what it can do for them. And so it's because it's helped me. And so I am so grateful that you're on here to kind of chit chat about that.
Sure.
And let me see if I have any other questions for you. I'm doing the Facebook live stream, and it doesn't look like anybody has any questions. Does anybody have any questions right now? You can just type it in on the live stream, or also through Blab. And if not, we are recording all of this, so I'll be posting it as well for the people that missed it. So if nobody has any questions, doesn't look like everybody does. So Austin, you did a really good job. You must have answered them all.
The main thing is we can talk about this, for hours, really.
Yeah.
But, it really comes down to is, do you feel the treatment's effective? Which I see that, you do.
Yeah.
So you can only talk about it so much. To really understand and feel the difference is to really come and try it out.
Mm-hmm.
It won't hurt. If anything, it'll be beneficial.
Yeah, no, exactly. Yeah. Yeah, for sure.
So through the work, there's the understanding as well.
Mm-hmm. Yeah. So I know it's kind of hard to like sit there and talk about it and not be able to have that feeling, like for me, right? Like when I was talking about the muscle tension just immediately going away. It's so nice to be able to talk about that, right? But to actually experience it is something different. And I've never really been, that self-aware person and like kind of there in the moment. And, when I'm going and seeing the treatments with you, then it's like I'm there, I'm in the moment, and I'm actually, I just feel so much better. And so it's crazy to me to think that there's something, that's out there that can put me in a state that takes my pain away and also does offer relaxation because that pain isn't there anymore. So that's been really beneficial. So another question that I have is kind of, what's the process, like how do you do a physical assessment and then kind of how do you structure out the treatments? Like what do you typically do in that regard when somebody comes to see you?
Well, usually, I'll just, what kind of pain are you experiencing? How long has it been going on? Is there anything that helps? Where does it hurt? How does it hurt? And then we pretty much start working. I don't really, the assessment isn't really, come and there are certain tests that are, conducted, and then I write out a treatment plan, and then this is your treatment plan. The treatment starts when you walk in the door, really, when you get on the table and we start working. So based just on certain stretches, what I feel with the hands, the feedback I hear from you is really part of the assessment. So the assessment is a treatment in itself.
Okay, got it. Because so like literally you do the assessment and then you start working that day because it's kind of like, well, why put it off?
Right.
Yeah. Okay. Great. And then, so I know you kind of mentioned that you do have a website, and so can you just kind of repeat that again, and then your Facebook page, just so that people can just kind of have that information?
Yeah, it's theartofstructuraltherapy.com. It's kind of an online brochure, if you will, an information packet, so you can delve more into the origin, like how it came about, the treatment, what it treats, and then there's the practitioners, and I'm on there. My Facebook page is The Art of Structural Therapy Austin, as in Austin, Texas, in my name. And you can book an appointment through there. You give me a call, and we can go from there.
Okay, perfect.
I have a place in Westlake, and you can come to me, and I also do house calls.
Okay, great. And so I know that, we brought you on as a guest, and also, if there's anything, do you have like a special offer or anything that you can talk to these people about, just to because I know that you're trying to get out there and meet more people, and also learn about more health and wellness, so people that are in that industry as well. So is there anything that you do, like an initial assessment? What's the cost for that and all that good jazz?
Right. So I guess anybody who sees this, we're doing a deal that if you call me and you say I saw it through 20/20 Meals, I'm going to be doing a 30-minute assessment for $45. So it's discounted.
Oh, okay.
A little bit shorter. So I usually do hours, but we'll do a 30-minute to kind of see how you react to it, see what you think, and we can move from there.
Okay, and so that doesn't necessarily. So that's the 30 minutes is outside of the assessment, right? So like you sitting there talking to them, or is that included?
It's included. It's the same thing. The assessment and treatment, it's 30 minutes is the same.
Oh, okay. So it's not like
It's not. There's an assessment time and a treatment time. It's the assessment and treatment is the same.
Oh, okay, perfect.
The
All right.
assessment is also the treatment.
Okay, great. I wanted to clarify, so make sure people weren't confused. Okay, perfect. And so I'll go ahead and send out these links and things like that. Also, I'll be posting that. And so if anybody has any questions, also it is really good to contact Austin on his Facebook page, because if you have any questions, even if you're not in the Austin area, he'd be more than happy to help you. He's answered like 1 million of mine. So, but yeah, so feel free to go post on there. Also, like you said, he's located in the Westlake area, which is over in Bee Cave in Austin. And so, yeah, and if you guys have any questions, just feel free to reach out. And we wanted to, as a company in 20/20 Meals, we wanted to bring you guys additional value outside of just the meal planning. So we're going to definitely keep this up. So we appreciate y'all attending and being part of this. And we will see you guys next time. So thank you so much.
Thank you, Cameron.
Uh-huh.